I'm going to show you how to do a head-to-toe assessment. So we do this when we've established that the casualty is breathing. We're not going to be doing CPR, but we need to check that they're not injured, they haven't got a spinal injury, or they're not bleeding from anywhere before we put them into recovery position. So ideally, you want to talk to the person throughout, so talk to the casualty and reassure them, and let them know as well that you're going to be touching them, because obviously you need to seek consent, everything that you do, but you don't want to surprise them as well. They need to know what you're going to be doing. So head to toe, you start from the head. So you're checking for any obvious signs of injury. So are there any bumps that you can see, so you feel around the head, back of the ears, and around the neck as well, right, like that. And what you want to look out for are obvious signs of injury. Are they bleeding from anywhere? Is there any fluid coming out of the ear? Any bleeding from the nose or the mouth? All those could be signs of a brain injury. And as you touch them as well, see whether they are wincing, because that's a sign that they might be in pain. So again, then you need to take extra care. So check around the neck, check around the shoulders on both sides. Then bring the arm up nearest to you. So just check like that. And again, check for any deformities as you lift the arm. If there's something that's concerning you, put the arms down straight away. Then you check the arm on the opposite side. So you do the same, checking for any bleeding, any signs of injury. Then check around the rib cage and the back, and also around the back of your hand across their chest. So there might be chest trauma or any sort of injury, and also around the abdomen. If the abdomen is distended, that could be a sign of internal injury. So again, we need to take extra care. When you get to the waist, just run your hands around. Again, you're checking to see whether there's any response that could show signs of pain, because they could have a pelvic injury. So again, just feel back like that and all the way down. So you're checking for any signs of injury, any signs of responses to injuries. You need to be careful when you get to the pockets. If they've got a mobile phone or a wallet, you could ask them what they've got in their pocket. Sometimes they might not be able to tell you what's in their pocket. Take things out if it's safe to do so. Otherwise, be careful, because people keep all sorts of things in their pockets. You could have sharps. So I'm reasonably confident that the person is not injured, and I can then proceed to put them into recovery position. That's how you do a head-to-toe assessment.